one of the most important things that we can do at FDA at this time, which is that for reasons that have to do with a combination of factors, vaccine confidence is at an all-time low, at least in my lifetime. And that's because we no longer, I think at least one of the reasons, we no longer see and feel the incredible benefit of vaccines. Nobody understands quite the fact that none of us really see smallpox. We saw it, we wouldn't know it unless we saw it in a textbook, because it's not around anymore. Polio and measles, many of these infectious diseases we have to study in textbooks because we don't see them except when they come to our shores as imported cases. And really, this issue, combined with what the fragmentation of society with social media, etc., has led to this real crisis in confidence of vaccines. So for us, getting back to vaccine confidence is incredibly important. And what we often hear is, well, all these vaccines have these incredible side effects, and the side effects are worse than the infectious diseases themselves. And we have to work to combat that myth. And it's true where you have very high vaccination rates, people seem to forget about the fact that, for instance, for measles, when you look, this is from an editorial piece by Peter Hotez in Marsh, where measles, mumps, rubella vaccine, an incredibly safe vaccine. It's not entirely with zero side effects, but you can see from the right side here, we're talking about some fever-related seizures in a couple of individuals out of 10,000 vaccinated.
In bad
Don't see any deaths on that side. On the other hand, if you look, we know very well that in low and middle income countries that measles is associated with actually a pretty significant number of deaths. And in a high income country like the United States, if we were to have it returned, we would also see deaths of measles encephalitis and possibly measles pneumonia. So, really important to get back to vaccine confidence. And I just show you the same issue here for influenza. Influenza vaccine saves lives, and yet we have people that you know, they're very insecure about taking the influenza vaccine because they believe it will give them the flu or it will do something worse. So vaccine confidence is the ultimate goal here of what we do, even though our regulatory remit is a quality, safe, and effective vaccine. So just to back up here, for SARS coronavirus 2, the main vaccine target that is being used for the vaccines that are being studied in the United States is the spike protein. This is this trimeric protein, 3 subunit protein that decorates the surface of the coronavirus, and which binds to the angiotensin converting enzyme 2 receptor to get into cells. There are other surface proteins that could be used as antigens, including the N protein, but this has been where most of the effort is focused on. That's not the only thing you can do in terms of making a vaccine. The vaccine approaches that have been used and include DNA vaccines, RNA vaccines. In fact, the two most advanced candidates in the United States currently are RNA vaccines. There are protein subunit vaccines coming up quickly in development. Outside of the United States, in both China and Europe, there are inactivated virus vaccines being developed. That's similar to inactivated poliovirus vaccine, where you grow up the virus and kill it and administer it potentially with an adjuvant. There are non-replicating viral vectors. There are those already that are in large-scale clinical trials in the United States in that category of replicating viral vectors that are in development. And there are further back in development or virus-like particles, some of which can even be used in plants. So lots of different approaches. And you know, these are just among the types of diversity that we'll be looking at in terms of vaccines that we currently have under investigation to drug applications, and ones that may wind their way ultimately to approvals. Just very quickly, all of us probably are familiar with the fact that vaccines tend to be tested initially in animals, then move into the typical phase 1, 2, 3 clinical development. The one difference to just note for vaccines is that phase 2 clinical development for vaccines can be pretty large, actually comprising hundreds of individuals rather than dozens of individuals as it might for instance, an oncology drug. And phase 3 clinical trials for vaccines, the randomized controlled clinical trials, can get to be very large. How large? Well, if you look, on average, many of these have, over the course of the years, have been involving 20,000 individuals. And in this particular case for COVID-19, the manufacturers of these vaccines have agreed to do trials of about 30,000 individuals, at least for 3 of the vaccines, and for a 4th vaccine that's just entered phase 3 clinical trials in the United States, which is the single-dose regimen that's being used as public knowledge. It's 60,000 patients in that trial. So lots of patients, which gives us large safety data sets and will hopefully get us answers in terms of these event-driven trials towards whether or not they are effective as well as safe. When we think at FDA about vaccine development, it all has to start with manufacturing quality, because that is just so fundamental here. And if you think about probably the worst event in vaccine history from the standpoint of FDA, it was the Cutter incident in 1955, in which it was ultimately a manufacturing quality issue where unfortunately polio, inactivated polio vaccine was not inactivated adequately, and children got polio from the vaccine that was supposed to prevent it. Can't have anything like that ever happen. So we spend a lot of time making sure we do not let history repeat itself, and we care a lot about manufacturing quality. We care about safety and efficacy. And in addition, in this particular case, as we'll come to, post-market surveillance, which is always important for vaccines, will really take on a heightened importance for a COVID-19 vaccine. So we, at the end of June, put out a guidance on the development and licensure of vaccines to prevent COVID-19, which really covered the waterfront here of what we expect for chemistry, manufacturing controls, non-clinical data, the clinical trials that we need, including the kinds of size trials we need, what we're expecting from post-licensure safety evaluation, the kinds of diagnostic and serologic assays that would be used in these trials to demonstrate effectiveness, as well as some additional considerations. And I'll spend a couple minutes now just going through some of the highlights so you have an idea. In terms of non-clinical considerations, we like to see non-clinical studies in animal models that help identify potential vaccine-related safety risks, as well